So, Prynhawn da pawb, good afternoon, everybody. I'm really pleased that so many of you have been able to join us this afternoon for this webinar, which is a webinar on giving every baby and child in Gwent the best start in life. And it's about a piece of work that we've done called the Joint Strategic Needs Assessment. So delighted to be able to present this to you this afternoon. Just wanted to start by give some quick introductions. So you've met my colleague Nisha Vasani, public health practitioner who has done the lion's share of the work on this Joint Strategic Needs Assessment. So she's going to present it this afternoon. And then in the background, my colleague Natalie Hazard is supporting us with respect to the question and answer session. I also have Florence Beach that's supporting us as well. And last but not least, Millie Meaden providing some technical support. So if we can move on to the next slide, just so you know what you can expect from the next hour or so. We hope that you find this session really inspiring and insightful, and we're really keen to hear your views and your engagement through the process, through the polls and through the question and answer session. So just by way of an introduction, I'd like to hand you over now to Professor Tracy Daskovich, who's the Executive Director for Public Health within Aneurin Bevan University Health Board. But more importantly, Tracy is a huge champion and advocate for babies, children and young people. And I'm so pleased that she's able to give her time this afternoon and to provide you with a welcome. So over to you, Tracy.
Thank you, Erin. Can you hear me okay?
You're just a little bit quiet. If you can just increase the volume a little bit.
And indeed,
Okay.
it's not something I'm accused of too often. It is a great pleasure to join you this afternoon and to echo Errol's words of thanks to the team in producing the Joint Strategic Needs Assessment. Those of you that have been sort of following our work over the past couple of years, we are building a real solid ground around intelligence and making sure that the work around public health is evidence informed. And the Best Start in Life is the first comprehensive needs assessment that we've done in a whole series. And of course, the first of 3 that will focus on babies, children and young people. If we do nothing else, we've got to get it right for our littlies. If we are going to really shift the dial on inequalities and inequities within a generation, which is our ambition, then we have to make sure that everything is right at the start of life. And that obviously goes right into maternity care and making sure that we are ready to welcome our babies into this world and be ready to give them the very, very best start and environment for them to thrive in. If we can achieve that, then we'll have achieved a great deal. And if we can have healthy children, we are going to have a next generation of healthy adults, which is everything we need to do. We know that children's voices are quiet within our system, and we don't often open our ears to what their needs are. And we learned that another piece of work that Errol and Nisha were heavily involved in was the DPH annual report last year, which looked at babies, children and young people and trying to amplify their voices in terms of what health meant to them. So it is my great pleasure to be able to have the hour with you just to hear the findings of the Best Start in Life Joint Strategic Needs Assessment, which is really going to set us up with a very strong evidence base to inform the work that we need to do to improve the lives of our babies, children and young people right across Gwent, challenge those inequalities and give them the very best environment to thrive and be happy. So I'm going to hand it back over to Nisha. She's the person we need to hear from this afternoon, but it's fantastic to be able to join you. So thank you to all for your input and contribution in this work now and obviously into the future. Thanks, Nisha. Back to you.
Thank you. I'm going to hand over to Errol to get it started.
Lovely. Okay, so if we could have the next slide. So I think what we're going to do to start with is just set out the Joint Strategic Needs Assessment very briefly within the context of the work that we've been doing in Gwent. And I'm going to give you a potted history of that. So back in 2022, Gwent, as some of you may know, was the first Welsh region to adopt a Marmot approach to tackling health inequalities, supported by the Institute of Health Equity And what that really meant was that at a strategic level across all of our public bodies, all of our public service board bodies, we committed to tackling health inequalities. And we did that via an approach which was guided by the Marmot principles, the 8 Marmot principles. And the very first of those principles is to give every child the best start in life. So this strategic and collective focus on babies, children and young people is really, really important for us within Gwent in terms of what we're doing to build a fairer Gwent, as Tracy has just set out. And in 2023, when Gwent published its wellbeing plan, the Building a Fairer Gwent report recommendations, including those around giving every baby and child the best start in life, were embedded into that plan. And by doing that, we also ensured that this work enabled us to align with and deliver our ambitions collectively as part of the Wellbeing of Future Generations Act. We could move on to the next slide, please, Nisha. And then, as Tracy's mentioned briefly, in 2024, we published the DPH report called Our Future, Our Voice. And this report really signalled our intention to put the voices of babies, children and young people and those that care for them and advocate for them at the heart of all that we do. And if you haven't read this report already, I'd really, really recommend it to you. In essence, the report advocates for a shift to a more inclusive approach. So it's really easy to say, give all babies and children the best start in life, but to truly give all of them the best start in life, we need to work in a way that is much more inclusive. It advocates a preventative and equity-driven approach. And it also recommended that we developed a suite of joint strategic needs assessments, and the first of those is what we're presenting here today, and it focuses on the preconception to the age 4 period. And for those of you in the audience that haven't come across joint strategic needs assessments before, it's essentially a way in which we're able to understand the health and well-being needs of our population, but doing that via a collaborative approach that enables partners to feed in, that enables the community to feed in, but also sort of really synthesises those perspectives with the data and with the intelligence. And you pull all of that together to enable you to have an evidence base in which you can use to plan and deliver services more effectively for the community. So that's a little bit of the potted history. I'm going to hand you over to Nisha now, that's going to talk you through the approach and the findings. Nisha.
Thank you. We're going to kick off with a little poll that is just, have you read any of the report? You've got a yes and a not yet option. Millie, that should load in a second. And you can submit your answers on the poll there. .56% saying not yet. So, as Errol quickly mentioned about what a JSNA is understanding the health and wellbeing needs of that specific population. So for our joint strategic needs assessment for baby children for the best start in life, we took 3 key steps, which was carried out between August 2024 to March 2025. So the data analysis was examining key health indicators to identify patterns and any priority areas that we need to focus our efforts on. Huge part of that as well was engaging with our families across Gwent and those key early years professionals. So we worked with our partners to co-produce an online family survey. We had a great response rate. We had 357 responses across these surveys. We also carried out 5 in-depth interviews with some mothers as well. And then we also engaged with around 60 early years professionals, and that was through a range of surveys, focus groups and conversations. Then the third step then was to undertake a map and gap analysis. So this was to identify strengths in the services that we have across Gwent, but also highlight any gaps. So this was also reviewing local and national strategies as well. And this allowed us to understand any opportunities that we had to improve the offer that we provide within that Best Start in Life. And I just want to highlight that throughout all of this process, we maintained that early years professionals collaboration, to making sure that there was accuracy in the survey, in the data that we were pulling, and that that report was firmly grounded in that co-production. So this was just some key data that we pulled across from the report. So with, as you can see at the bottom here, we've got around 5,714 live births within 2023, which when we look at it, it is a manageable denominator, and that allows us then to carry out those in-depth early analysis of those early years needs. So I'm just going to focus on a couple of bits of these data. So for example, we had 61.1% in 2023 of mothers living with overweight and obesity. And then going into that birth, then we had about 47% of mothers that received an assisted delivery. We know that living with overweight and obesity means that you're having some extra growth scans, that you might have some additional appointments, and that can also mean that you're requiring an assisted delivery at birth. And as well, we just want to look at 67.1% of mothers expressed an intent to breastfeed, and this was slightly dropped to 57.9% of mothers breastfeeding at birth. By comparing this data as well to the rest of Wales, it helps us to identify any outliers, so areas that we are performing significantly better or worse, and that also ensures then that we can do deep data dives to understand how we can support our health improvement programmes, and also set measurable targets to track that progress. This is then the current picture from the 0 to 4 period. As you can see, we have 18.6% of children between the ages of 0 to 4 that are living in poverty, and 305 are looked after. And we know that within Torvine that these are the highest rates across the whole of Europe. So it highlights how we, as a collective, need to do more to support that Best Start in Life. So from the engagement then, what we heard from families. So we noticed that families expressed that they were having conversations with their midwife around how to support a healthy pregnancy, but then that signposting to that further support and information was slightly limited. And that they found that there was limited access to maternal mental health support. But also we noticed that many reported that they felt really heard and supported during their labour and birth, which is such a vulnerable time for a lot of women. So to feel and notice that that support had been had by these women is such an important thing. What early years professionals told us. This is a whistle-stop tour, so apologies. But having Badgernet has strengthened collaboration. So the fact they were able to share safeguarding information with other trusts across England really supported those vulnerable families. But there is that need for a more collaborative and ongoing postnatal support for vulnerable families where they've had their child removed from social services. So they're going through a very vulnerable, traumatic time, is ensuring that they get that support when they need that support. And a piece of work that we're already doing, which we'll go into in a little bit more detail, is developing that shared definition of school readiness and how we can support babies and children to meet their milestones. From the map and gap analysis then, we noticed that there is an inequity in access across the local authorities. So, for example, something that we will find as a service in Blaenau and Gwent might not essentially assist in other areas. So it's just ensuring that all residents across Gwent have that access and that it is equitable. and also highlighted the importance of having those place-based services as well. So there's one-stop shop hubs where people can access a range of services without having to go to various different appointments. We noticed then in terms of service gaps that there isn't much out there in terms of that mild to moderate perinatal mental health support and a level 2 children's weight management service as well. And then in terms of vaccinations, we noticed that there was an inequitable uptake for children and also for women getting vaccinations during their pregnancy. There were some barriers. So just going to have another little poll pop up from Millie. Don't mind loading that, which is, do you feel that the findings reflect what you see in your area of work or your role? And the answers, options are yes, somewhat, no. And move on then. So we've got the 17 recommendations. So I'm carrying out these 3 steps, then we pulled out 17 recommendations in total. So you can read the full list of these recommendations in our executive summary or the full report. But just to cover 3 key recommendations that we've pulled out just for the purposes of this webinar was that we need to do more in terms of analysing data on the lifestyle behaviours during pregnancy. So as I mentioned, the proportion of women living with overweight and obesity, and then the mode of delivery. So we need to understand how we can better support women during that pregnancy period to ensure then that they're able to support their child to give the best start in life. Within that, then we can look at how we can enhance the messaging, enhance the antenatal care that we provide, and also support services that we refer signpost onto. We identified then exploring the opportunities to broaden the scope of MEC training, better equip midwives and health visitors to understand and confidently discuss sexual and reproductive health, but also recognise their role in providing contraceptive advice as part of their routine pathway of care. And then, as I touched upon previously in the mapping gap analysis as well, we highlighted that we need to explore opportunities to address gaps in children's weight management services, particularly at that level 2 pathway. I'm going to hand over to Errol now, who's going to run through our take-home messaging.
Lovely, thanks, Nisha. So I can see that we have plenty of time, so we're probably going to take a bit more time to maybe go through some of these themes that have emerged from the Joint Strategic Needs Assessment. So, and the work is so comprehensive. There's so much within it. It is quite challenging to distill it. But nevertheless, there was a very clear theme about the need to do more at an earlier stage of the life course. And that isn't just about the pregnancy phase, it's what we do for preconception and the support around planning for pregnancy. So, and often you'll hear us say this in public health, you know, we sort of need to shift further upstream, whether it's about the causes of health or whether it's upstream in terms of the life course itself. So that was one of the themes, I think, that emerged really clearly, both from the practitioner perspective, from the perspective of the community themselves, the focus groups that Nisha undertook, and through the data. And then the other themes that came through really strongly, and this relates to that point around giving every child and every baby the best start in life, is that we need to think specifically about the support that we provide for low-income families. And notwithstanding all of the fantastic work that is already ongoing in this early years space, there's still more that we need to do to better support early child development, and to understand some of the challenges around child development, and what more we can do as services, and what more can be done in terms of community to support to ensure that no child or no family gets left behind. So that was the other really clear theme that's coming through, and later on we'll come on to talk a little bit about some of what's happening in response to those two themes that have come out of the JFNA. So I think now we're going to give another poll, is that right?
Yes.
Yeah, okay.
So Millie, if you can load that for me. It's, in your opinion, which area or aspect of starting life would you like to see more of a focus on? So this is an open word cloud type questions. You can type in some answers. I'm going to go on to the next one then.
Okay.
Or do you want me to go through the word cloud?
No, let's move on, and then we can come back in terms of what's come out of some of the polls at the end, if we have time. So in terms of what next for Gwent, if we can go on to the next slide. Some of you will be aware that Gwent Public Service Board, as I said earlier, has prioritised Best Start in Life as one of its 4 key areas of focus. So that's really, really important in terms of having that strategic focus on this part of our population. We have to support the taking forward and the development of plans around Best Start in Life. We set up a regional management group that's in place already, and probably some of the people on this webinar today are part of that regional management group, and I know that many of them supported Nisha with the Joint Strategic Needs Assessment. They helped shape it and they helped contribute to it. And then in addition to that, at a director level, we're also in the process of forming a Best Start in Life leadership group for the region, and that group will meet for the first time later this month. It'll be important that as we move forward and we develop the plans, take forward Best Start in Life in Gwent, we're taking into account not just what come out of this Joint Strategic Needs Assessment, but also what came out of the Marmot report and the recommendations within that. And we'll need to make some strategic decisions about how we prioritise our efforts in the region to focus on getting the greatest impact for giving every baby, child and young person the best start in life. And then just finally, some of you will be aware that the rest of Wales are watching keenly what we're doing within Gwent, because at the start of the summer there was an announcement that Wales is what's known as a Marmot Nation. And so there's keen interest from other parts of Wales and from Welsh Government in what we've done so far to support the agenda around Best Start in Life, but also what our plans are in future. So we really want to share our learning in a way that's helpful for Wales as a whole, and that's really honest about some of the challenges around collaborative working and how to work effectively through intersectoral collaborations and partnerships. And we want to, I suppose, be able to learn ourselves and reflect on our own practice. So that's really significant development for us here within Gwent, and we look forward to sort of moving forward with the rest of Wales on that. Next slide, please. And then sort of coming back to thinking about this quite practically, and for any of you that know me, you'll know that I am a very practical person. I'm very interested in how things get translated into action. So what we really don't want to happen with this Joint Strategic Needs Assessment is it to become the document on the shelf, or these days, the document that's electronically filed away somewhere. We really want the contents of it to help support the planning and delivery within the region. We want to help strengthen that function, and to think about it as well in the context of where we have gaps, where we've identified gaps and where this JSNA may be able to support with business cases, with funding proposals, with making the case for unmet need and what we could do about it. So that's one really important point. I think another really important point is around how we strengthen our use of data and intelligence to drive action and to understand how well we're doing with that ambition for every child within Gwent. And you know, some of the data that Nisha presented earlier is really quite stark. We can't shy away from the fact that we have some significant challenge within Gwent, but the point is we need to be organised around how we use data to focus in on the things where we can make a big difference, and how we use data to understand whether we're making a difference or not. We really want to promote the shared ownership of this. We couldn't have developed this JSNA in isolation from our partners across Gwent, and we really want this to be seen as a suite of tools that will help everybody in their work. And we'd really encourage the approach to be applied more generally if colleagues feel that that's helpful. And as Tracy mentioned at the start in her welcome, this is just the first of a suite of JSNAs. We've only covered off, you know, that period 0 to 4 through this particular piece of work, so we need to move on to do the same sort of exercise for the other stages of the life course up to the age of 18. So really asking for your help and your continued support and collaboration to get those two pieces of work off the ground as well. So really keen that this becomes something that we use, and really open to sort of feedback from you with respect to the utility of it and how we can improve that. Okay, next slide.
Thank you. So as I mentioned earlier, we've started progressing some of those recommendations so far, and this is just an example of some of the things that we've started doing across Gwent and with our partners. So, for example, supporting postnatal contraception. So our lead public health midwife has been going out and training all of our community midwives so that they can provide bridging contraception. So this enables the community midwife to provide a 12-week supply of the pill or the Depo-Provera injection. And more recently as well, our midwife is going out and supporting with training on the contraceptive implant. And part of that work then from a Gwent Public Health team is we will look to focus our efforts on how we can boost midwives and house visitors' confidence in discussing sexual and reproductive health. The antenatal programme, so we've got our senior practitioner Flo supporting this piece of work. So improving how we can collect data for those that access the Gwent antenatal programme, and how that data collection then can support how we deliver the programme. So this is around ensuring that we're capturing demographic breakdown. So are we targeting the population in the areas that would benefit from the programme the most? And then we can understand if the programme reaching who it needs to reach. A huge piece of work as well, also led by Flo, is our school readiness project, which is now being named Ready to Learn, Ready to Grow. So this is a piece of work that was funded by our Welsh Government Child Poverty Innovation and Supporting Communities grants. This project started in April 25 and is running until March 26. And there's been a huge collaborative element with this. So it's collaborating with other services and teams across the Health Board, the 5 local authorities, Bullvine Voluntary Alliance, our HDRC, Cardiff Met, and it's being led by Home Start Cymru. So the aim of this Ready to Learn, Ready to Grow, is engaging families and healthcare professionals to provide that direct intervention. So we're looking to support around 50 families. So we have our briefings that are shared on our webpage as well, and we've got our next briefing coming out soon on how the project's progressing. So please check that out. In terms of BadgerNet data, so as we mentioned, BadgerNet has strengthened collaboration immensely with our other trusts, and we have also now had notice that BadgerNet is going to be launched across the whole of Wales. And just looking at some of the things that we can do with that BadgerNet data, it's live data. Our public health midwife was showing us the different ways that we can pull that data. So it helps us to understand an individual's journey from when they became pregnant, access their first booking appointment, to when they go on to have that child. And it helps to collect comprehensive and consistent data. And we're able, now that we're starting to see full data sets of a pregnant woman's journey, we're able to carry out an in-depth analysis, identify trends, and generate meaningful insights to improve maternal health outcomes. Also, we're doing a lot within that vaccinations and pregnancy space. So there's been challenges in terms of delivering and recording vaccinations in pregnancy. However, there's been collaboration ongoing between the maternity team and the HPV vaccination service to show what's actually possible. So, for example, we've had the successful delivery of the RSV vaccine in antenatal clinics, and this has demonstrated then how integrated working can overcome those barriers and also improve access for pregnant women. And we're doing some more work then to look at how we can present the positive uptake in the antenatal clinics, and also work to widen that offer if that funding at that timeline allows us to do so. And then within the childhood in space, uptake across Gwent for children up to the age of 4 is shown to be about 83 to 84%, highlighting that we need to do a lot more within that space. And work is already ongoing to do that. And within areas where there is consistently low coverage. So this has been focused on cleansing the data that we currently do have, providing domiciliary immunisations, providing staff education as well to have those conversations with families, but also to do some outreach to those underserved communities. So bringing that care closer to home, as opposed to potentially putting in unknown barriers that make it difficult for families to access immunisations. So as part of that, we've been exploring the use of the bed van mobile unit, and they are going out in October to deliver the influenza vaccine in areas that have been piloted for that target delivery. And part of that project as well will be by supporting local language insights and improved data sharing. So we're making some huge waves, and this is just the beginning essentially. And so much has already been done as well. That's not completely ignoring that as well. So as I mentioned then, so on our Best Start in Life webpage, which is hosted on the Anira Bevan website, we've got all 5 reports uploaded. So we've got a technical report, which is the full summary of the work that was carried out, an exec summary, which provides a brief overview of the key findings and those 17 recommendations. Our context report, so this highlights the why it is so important to focus on the Best Start in Life, and to the impact that this can have to longer term health. Our intelligence report, so this is all the data that we've used throughout the report. We've just pulled it into one condensed report that's easier to find. And then the 5th document is all the data sources and references for where we pulled our data. So if you scan the QR code, it'll take you directly to that page. And as I mentioned, we'll also be hosting our school readiness briefings on there. Our DPH report, which Errol and Tracy have touched upon, is also on there. And also this webinar will go on. And we've just got our final poll then, which Millie's going to load up for us. And it's, do you see yourself using the JSNA in your planning or in your day-to-day work? Yes, not sure yet, or no. And we will go through these answers after the Q&A as well to see what people have thought. So we've got a little bit of a Q&A session with everybody. People have been putting stuff in the chat or in our Q&A discussion. No?
No. We've got no current questions in our Q&A section, but I'd like to invite anybody who doesn't have any questions right now to raise your hand. If we can just really ensure that the cameras are enabled, please facilitate that. But yes, please do put your hands up if you have a question.
Georgina, we're just, Millie's, there we go. Millie's just disabled everything, or technically enabled everything. So we're going to go to you, Georgina, first. Thank you so much.
Oh, hi there. Yes, one of the findings that you spoke about was that childcare practitioners said that they need more training in child development. And I was really curious about who the childcare practitioners encompasses, what different roles. And sort of said more specifically what it is they think they need.
Yeah. So I'm happy to answer this one. Yeah. So we opened out the early years professionals survey, specific survey to preschool settings across Gwent. And we asked them if they felt that they had enough training to sufficiently support the children that they work with and care for. And they highlighted that they would like opportunities to engage in more training, specifically speech and language, so how to support a child's speech and language development. But they also highlighted trauma-informed care. But the issue is that they identified challenges in actually attending training sessions. So some of those challenges were, excuse me, that it was difficult as they had to kind of attend these training sessions outside of their already working hours. That training sometimes wasn't kind of available when they needed it, and it can be such a difficult barrier to overcome. They acknowledged that it's not always easy to attend these training sessions, but they welcomed kind of that opportunity to explore that. I just want to highlight as well, with that early years framework that has been launched by Public Health Wales, there is emphasis on how we can support early years practitioners to undertake training and identifying some of those barriers and how we can overcome those. I hope that answers your question.
Yes, thank you. That's really informative as a reply. And I was just thinking that probably there is inequity about that currently across Gwent. But I'm very aware, for example, that the Gwent Attachment Service provide trauma-related training to certain preschool settings currently. So, yeah, just a service to be linking up with to see how that is progressing, really, to feed back to you guys.
Definitely, and I think there's so much more work that we can do with that space, with those preschool settings. But also there's so much more on, I'm happy to share these with you as well, Georgina, the details on that survey that we undertook with our early years professionals, and those gaps they also identified, in those barriers as well to actually attending those training sessions. Thank you so much.
Thank you. I do have something else I'd like to ask, but I'm happy for other people to have a turn and come back to me later.
Okay, I'll go to Ruth first, as I can see your hand, and then I'll come back to you if that's okay.
And Ruth, I can see that you put a comment or a question in the quick Q&A. So if you want to come in and ask that, that's fine.
That would be great.
Thank you. Good afternoon. I'd just like to ask what strategies you have in place in regards to the number of CLAR children. Myself, I'm a specialist health visitor in Caerphilly. I am seconded over to Children's Services, and I work with families whose unborn is open for pre-birth assessment in the hope of increasing the number of parents who keep their babies in their care. I've always noted that Torfaen have the highest number, which I thought was the highest number of CLAR in Wales, but as you said, is now in Europe. Unfortunately, Torfaen do not have such a specialist service. The only specialist services available are on Newport and Caerphilly. How do you intend to bridge this?
Yeah, I can come in on that, and thank you for raising it, because I suppose one of the things that has come through this joint strategic needs assessment is some of the challenges of working things across the whole patch and across the 5 local authorities within the patch. And with respect to the issue that you've raised, we've noted that there is provision in Newport, the Baby and Me, and we have an equivalent programme within Caerphilly. We have had some discussions with Bernardo's that lead on the Newport programme about how we can explore additional funding that would enable them to spread some of that, what is widely seen to be sector lead in practice in Newport to the other parts of Gwent. So we have had, and I'm sure Mark would mind me name dropping him, so Mark Carter from Bernardo's, we have had some discussions about that, and there are some plans in place. We've got a particular funding pot in mind for exploring how we can extend that. But I'm also aware that through, I think it's Torfaen local authority, they're doing a piece of work to understand in more detail what has driven the very high rates of looked after children within that patch. So there's also that specific work ongoing within that local authority. And sometimes part of our challenge is how we join these pieces of work up and how we make sure that all of the right people are aware of what's happening where, or what discussions and meetings are going on where. So I think you've raised a really important point in terms of that objective around ensuring that all babies and children have the best start in life. And sometimes it's very easy to forget that particular subpopulation of children. So thank you ever so much for raising that. It's an issue that's really close to my heart. So yeah.
Thank you.
I just wanted to add on to that as well, that one of those recommendations is looking around how we can also have some more place-based services as well. So whilst that isn't specific to care experienced or looked after children, but understanding how we can support families so they're not having to attend various different appointments across their patch, or even sometimes across Gwent, and how then that can sometimes be seen as disengagement or disinterest, when it's actually just that we're not putting those mechanisms in place for them to be able to attend those appointments with ease. So part of that is how can we support those people closer to home and remove as many barriers as possible for them to access care and support. Thank you so much.
Sarah much have added a comment to the chat. Sarah, feel free to come in if you'd like to, or I can summarise it.
Putting you on the spot here, Sarah.
On the spot, Sarah, but I can summarise.
I'm happy to come in. I usually do. Yeah, it was more a case of, I know the school readiness project is quite an interesting one. It's a pilot for 50 families. I just felt that when we acknowledge the developments that we've done so far, there was an awful lot of work that we did under the Early Years Transformation Programme, including that information sharing protocol that's enabling the antenatal notifications to come through. Now, from a Caerphilly perspective, we've changed all our services to be borough-wide. It's only the childcare aspect that is still needs-led postcode, and then needs-led outside of that postcode. So that's the tricky bit that's left, but everything else, the family support aspect, and we're certainly having those conversations antenatally with every family, and every family's been allocated a family worker, and we work very closely with Ruth, so I was like, yes, Ruth's on board. She's there. So it's that kind of making sure that you proportionately give the right level of support to families that need it, because not everybody needs everything, but it's having the right information to everybody, and then it's looking at what are the antenatal programs, what are the antenatal contacts that are needed to keep checking in, and making sure, because things change quite quickly, during a pregnancy. So I think the needs assessment is really interesting. It gives lots of shape to what we'll be doing as we move forward and making sure that we are covering off everything. From a local authority perspective, I just think I would have liked to have seen that acknowledged in the slides, because I think we did a hell of a lot of work in the sort of last 5 years then, you know.
Completely agree with that. I'm going to let Errol.
Yeah, absolutely, Sarah. I would agree with that. There's so much blood, sweat and tears that went into that early years integration work, and it's hard. Sometimes it's hard to capture the full background and the full journey that you've been on, but I would absolutely acknowledge all of the developments that happened under that early years integration collaboration, because they have absolutely got us to a much better place in terms of Gwent-wide approaches, and really, I suppose, how local authorities and health work together to support families. So absolutely 100% agree with you on that point.
Are there any further questions from anybody?
Gina. I was as soon as you put your hand up, I was like, I remembered.
Shall I come back in now if there's no one else asking anything else at the moment? One of your other findings, you say, is service gaps in mild to moderate perinatal mental health. So I'm very, very curious to hear more about that, given I'm a clinical lead in the Gwent Parent to Infant Mental Health Service, where we try and target that population, where there's an impact on the impending baby, or in fact the baby once the baby's been born.
So yeah, this was around mothers feeling that they were able to kind of look after their own mental health, so signposts into those self-help resources. So appreciate that there are some incredible services that do exist within that perinatal mental health support, but it was that mild to moderate that they kind of felt that it might not necessarily be a service that they need that specific support from, or whether it's just some signposts into some information where they can support their own mental health. But this is also kind of repeated in terms of birth partners also, or partners sometimes feeling a little bit left out of that whole process, and appreciate and within that feedback we had, partners themselves also recognise that, you know, everything is about the mother and that baby in that moment in time, but also supporting a partner's mental health is crucial in terms of then that mother feeling supported as well from the back of that. What was the other part of the question? Sorry.
I think that was most of the question, but just following on from partners, and it's probably outside of this particular gathering at the moment, that would be something I'd be interested in discussing in terms of public health reaching out to partners, because we try very hard to involve partners in our work within our service. So very, very happy to discuss that further outside of this.
Yeah, we would absolutely welcome that. And also it was just highlighted as something as well with parents that are just adding to this, that were on the neonatal ward as well. And again, they highlighted that rightly so the support is provided to that baby in that moment. Having had a baby in the NICU myself, I definitely felt that whether there was some support that could have been kind of guided to how I could support my own mental health in that moment, I would have greatly welcomed, and that was kind of fed through as a bit of a theme as well. So it's definitely not a kind of ignorance towards what already exists and the amazing work that is being done. It's just around how we can support that self-help aspect, so that people aren't needing to access those services further down the line. I hope that.
Thank you. Yes, thank you.
Thank you so much.
I think I just wanted to come in on this, Gina. I don't know whether you looked through the data, and you may be aware of this already, but there's so much data within this report. But one of the bits of data that stood out for me was when we looked at sort of pregnancy. It was that 23% of mothers disclose a mental health condition. What point was that at?
So that was at their initial assessment.
At their initial assessment, and that's, you know, I don't know whether you looked at that. I'm quite surprised about it, but it felt quite high, you know, about a quarter. And it's and then it's a mental health condition. So we're not sort of talking about maybe anxiety, depression or low mood. And I think it would be good for us to sort of try and understand, to do a bit more work and a deep dive around that data, because that for me is quite stark really at that point. So I thought when we were, as we were sort of talking in this space around mental health, I just thought I would flag that as well as something that I'm thinking we need to do a little bit more work on.
Definitely.
And going forward as well, as we mentioned about Badgernet, so that, you know, with Badgernet you can record any referrals that are made. So we want to be able to pull that data. We have got some great work planned around what we can actually do with that Badgernet data and how we can improve the support that we're providing. Are we seeing the referrals going in when they need to be, etc. So that's kind of a huge piece that we've got coming up at hopefully the end of September. As you can tell, I'm an advocate for Badgernet.
Can I invite Kerry to ask a question, please?
Yes, hi, good afternoon. I've got a few, I suppose. The first one was, would we be able to have this information, the stats in the infographics broken down to a local authority level? I did request some of this data earlier in the year from various people in health, and I found it really hard to be able to access this kind of data on a local level. And we've got a subgroup in Blaenau Gwent called The Best Start in Life, where we were looking at these actual facts. So if I could have that for a Blaenau Gwent perspective, that would be great. The second one was also, I'd like the information that the preschool providers have feeded back about training, because I'm quite surprised about that. All local authorities have an annual training programme that we provide training to our preschool providers, and we usually do a training audit and survey asking them what they would like to see on the training programme. They come back with all ideas, and I would like to think we were responsive to their training needs. We also have a grant from Welsh Government that comes through CCG through the Childcare and Play for the training aspect of workforce development. So again, I'd love a bit more information about where that came from and what they would like to see. And then the third one then was around the obesity, fascinating fact, 61%. So I wanted to ask, at what point through the pregnancy is that measured, and what is done in response to that 61%? Because in Blaenau Gwent at the moment, we are looking at a early years nutritional pathway. Well, in fact, we've developed it in conjunction with dietetics in an Iron Bevan, starting from antenatal that will go straight through and feed into the healthy and sustainable preschool scheme phase. So yeah, I'd love more information about those obesity rates. That is fascinating.
Yeah,
I'm happy to respond to some of that, Kerry. Kerry, thanks ever so much for coming in and raising those issues, and thanks for your ongoing commitment in this area. You're such a huge champion for Blaenau Gwent, so really happy to share the data that we've got at a local authority level where it's available, and for you, you'll be able to look at that, you'll be able to translate that into real numbers.
Absolutely.
And to be able to use it in a real tangible way. So really happy to support on that, and also to go back and look at that that training feedback that Nisha had, and try and get a bit more nuance around that for you to see whether there is something we need to respond to. And then I think in terms of that obesity data, we have in place a weight management in pregnancy service, and it's fairly new. It started in April, but we are starting to see the referrals go through, and we've got that broken down by local authority, and we should be able to share some of that data with you as well. But the point that you were making about your early years nutrition pathway, that's exactly what we want, because we want to get upstream of,
we
don't respond when people are already pregnant. We want to be trying to prevent that bit about preconception care. So I think that work that you're doing in Blind Gwent to support that early years nutrition pathway, and then that following through into those school settings, is exactly what we need, because we're sort of responding a little bit further down the line, during pregnancy here. So really happy to share some of that. And sometimes what we're trying to do is knit all of this together and understand it for each individual woman, aren't we? So I think further conversations on that. So thanks ever so much for your questions. I can see Natalie's just flagging the 5-minute warning for me, and we've got 2 hands up. So I'll go to Natalie just to work out how you want to manage that.
Yeah, Gemma's got the first hand, and then we'll go to Tracy after, if that's okay. Gemma, we can't
Hello
see you.
all.
Hi, Gemma. Hello.
Apologies, my reception is dipping in and out. I just wanted to say thank you for sharing that. I'm under no kind of illusions about what a huge piece of work that has been for you guys, and so it's great to have that all in one place. I think where my mind was going now was the kind of next stage of the next sort of assessment, and just one of the things that we're all kind of on the same page around is that how do we tell the story about the lives of mothers and children's, which means that children's trajectories go in certain ways, really. And so just that kind of, I suppose, just wondering about how you're going to interweave those kind of different phases of child development, because what we know often is that kind of funding for the kind of early intervention prevention work can sometimes get very quickly sucked up and redirected into the kind of responding to crisis, which of course is really, really important. But what we know is those kind of early stages of supporting mothers with their own well-being, supporting people to understand child development, all of that stuff that goes on early really helps in children's psychological, emotional and physical development. So I guess it was just a bit to kind of understand, are we going to be able to track then, this is what happened in these areas, and this is what the children are kind of expressing themselves in the next kind of age group up and the next, so we can see that kind of pathway and story, really.
Yeah, there's 2 things, Gemma, as you're speaking. I'll just say what my thinking is around this in 2 ways. There's one way of looking at it is around the data and the modelling, and we've had some early exploratory conversations with ABCI to look at how they might be able to support us with sort of understanding some of the trajectories for babies and children within Gwent, and the things that are helping and making a difference, and where we might be able to do things differently. But there's something that's equally important to that, which is about the narrative and how we're able to talk about what's happening within Gwent and what our ambition is. And I think we need to think about that in relation to this suite of JSNAs, because there's a very detailed sort of technical stuff around the sort of data and the recommendations. But what's also important is how we're talking about what these journeys and these life courses look like for these different populations within Gwent, and particularly for some of our subpopulations where we know we need to do more, not just geographically, but children with protected characteristics. And I'd really like to think through that leadership group that I talked about earlier, how we can start to get some sort of consensus and collaboration about how we describe that in a narrative way that can go alongside, what the data is telling us. So that's sort of what my thinking is at the moment. But I think we need to discuss that collectively within that Best Start in Life leadership group within Gwent. I think that's, early doors what we need to be doing. I'll pause there because I think probably Tracy
Thanks,
would like.
Laurel.
Yeah,
Thank you so much, Gemma.
Tracy, would you like to come in quickly?
Really fast. Just to say massive, can you hear me okay? Sorry, my audio's dipping in and out terribly. It was to Kerry's point really on the data, just as some reassurance and some of the next stage conversations we're having. One of the challenges we have in this space is information sharing. So how do we get that across organisations? And Stephen Vickers and David Leach are very, very, very strong in this space. So having lots of conversations with them in terms of how we can really start to do that and get linked data right across the services that our children use and need to use. The other challenge we have is the information we don't know. We tend to get guided by the data we have available to us. And I think one of the pieces of work that I've talked about is creating a bit of a mind the gap in terms of us being aware of the stuff we don't know. So the data we do not collect, to make sure that we're not blind to the fact that we need to be guided about the things that really matter to our children and their families, and not just focus on the data that we do have. So being mindful about what we don't know is also really, really important and part of this work. So where you come across things that you think would be helpful, be good just to have those flagged to us, so that we can try and work out if that data can be gathered. And of course, this isn't just about a numbers game, this is a people's game. So listening to people's stories and lived experience is just as vital to us as having that hard data through numbers. So the more that we can gather from people and understand what you know, the more that we can put into the JSA and make it the biggest and best complete document we can possibly have. The ambition is that we have a single version of the truth for Gwent that all of our organisations use, and we're all drawing on the same data to inform the way we develop our services. So just to let you know that work is going on with Torvine and Blanau Gwent Council, so that we can start and really do that as a test of concept, so that we can then scale and spread across the whole of Gwent. Thanks, Errol. I shall stop talking. Thank you.
No, excellent. Thank you. Okay, I think, we've just gone 3 o'clock, so we'll probably pause it there. I'm looking at my colleagues across the table here. I just want to say thank you ever so much, everybody, for not just your engagement this afternoon and your time this afternoon, but also for all the contributions and the help that you provided us in the development of the JSNA. I think this is, another step along that journey that I set out at the start. There is nothing more critical than the work that we were doing in this space around babies, children and young people. So I thank you for your ongoing commitment and passion around that. It's something that is hugely motivating, I think, for all of us across the region. So just leaves me to say, diolch yn fawr iawn. Have a good rest of the day, and hope to see you all shortly. Thanks ever so much. Bye-bye.
Thank you. And also my email address if you want to send any questions through.
Thank you.
Thank you.
Thank you.